How often do you hear about core stability when discussing aches and pains? Many believe their back pain stems from a weak core, either through innate belief or as diagnosed by their therapist. But what does core stability truly mean? In the world of health and fitness, people often equate core stability with their stomach muscles. However, the core is much more than your abs. It includes the transverse abdominis, key deep abdominal muscles which stabilize the spine, internal and external obliques, rectus abdominis, your six-pack, diaphragm, hip muscles, pelvic floor, and deep lumbar spine muscles. And so just doing crunches isn't enough for core strength. But anyway, studies consistently find no connection between delayed activation of the core, transverse abdominis in particular, and pain. In a study titled, Effect of Core Stability Exercises on Feed-Forward Activation of Deep Abdominal Muscles in Chronic Low Back Pain, a randomized controlled trial, it was concluded that abdominal muscle onset was largely unaffected by 8 weeks of exercises in chronic lower back pain patients. It concluded that there was no association between change in onset and lower back pain, so there is no evidence that those with lower back pain have a delayed onset of core activation, that any apparent delay is not important to the causation of their pain, and that core training does not improve any timing issues anyway. So, actually, the link between core stability and pain is pretty unstable. Lower back pain is always multifactorial, and often takes a multifactorial approach to recovery, and whilst most interventions including core training can help a bit for a bit, there is usually no one singular intervention that is a magic bullet. For personalized advice, visit www.dcinjuryclinic.co.uk.